Well, hello everyone. Welcome to Shriners Children's Hospital. I'm very, very excited. I got to join in a surgical procedure with Dr. Carolyn Yao. Dr. Yao, welcome to today's program.
Thanks for having me.
What different kinds of procedures do you normally do? Is it always plastic or different?
I'm a plastic surgery specialist, so I do things like facial malformations, ear reconstruction for ear malformations, moles, burns, also cleft lip and palate, which is an example of a surgery that's fairly short. It's 1 to 2 hours, but very life-changing for a child and a family.
So for the different procedures, is it important to do that at a certain age? You know, this procedure for a younger age and other procedures you have to wait till they're older?
Certainly, there are certain procedures that children need earlier to help in their development, whether it's speaking, eating, or social growth. And then there are certain procedures I delay until later based on growth of the head and the neck.
As I understand, things like the nose, don't you have to wait till a little bit later?
Many larger nose operations I wait until children are done with growing because your nose does grow very differently as you get older and during puberty.
Well, back to today's procedure. For the recovery, how long will it take for this child to feel that they're ready to go out and play again?
Immediately. She was ready to jump out of her bed and play and eat right after.
That's wonderful. I understand that Ally Pacific works with you on a real close companionship basis. Do people come from far away just to have your expertise?
They often do, just because it's rare to be trained in plastic surgery and pediatric plastic surgery. So the Allied partnership has been really wonderful. I've met so many of their patients, and they'll come from anywhere from in this neighborhood in Pasadena to hours away to have specialty care.
And that itself, just being in Pasadena, such a beautiful environment, I think also helps put everyone at ease, mom and dad and the child. So for people like me that have a dream of becoming a surgeon, tell us a little bit about your background. What did you go through to become the surgeon you are today?
It's a long road, but certainly I think the most fulfilling thing that I do, and I'm so happy doing it, it starts with 4 years of college, which I did at Princeton, and then 4 years of medical school, which I did at Columbia. From there, I did a 8-year residency program at University of Southern California, which is an apprenticeship of sorts. So that's 8 years, and then I did an additional year after I became a plastic surgeon to train, especially to work with children that you see at Shriners, and that was at Harvard.
Wow, and I suspect that even in high school, you had already developed aspirations to become a surgeon. Is that correct?
Aspirations to be an artist of sorts and someone who helped people and had an impactful career. So it came together pretty amazingly in plastic surgery because what I do is very artistic. I plan 3D modeling, very much working with form and function in the way that they come together for someone's face or their life. So in that sense, I feel so grateful and fortunate for what I do every day.
Because from an outsider, not knowing what's going on, it does look like a combination of art, surgery, medicine, all combined.
It is.
So talking more about Shriners, I understand that there are hospitals all over the world. I believe there's 22 now. Is anybody able to come to Shriners if they have a child in need, or how does this work for them to be able to?
I think if the child has a condition that's appropriate for someone like myself, a plastic surgeon or an orthopedic surgeon to care for, we are open to everybody. And
is that what you specialize here? Is Shriners Children in Pasadena? Is that what you, orthopedic, plastic surgery, skin
burn
grafts?
surgery, which I do as well.
Okay. Now for burn surgeries, are there many victims that are from car accidents and things like that? Or
There are, I think, especially in California, we have wildfires, we have big freeways, we have car accidents. All of that combined means that we see the most burn volume, I think, of many cities. So I especially did train to do that, not just surgeries, but the wound care or just care right after you have the burn experience. For plastic surgery, certainly there are a lot of innovations such as skin substitutes that we use today that are engineered in a lab. Instead of using a patient's own skin, we have materials I can use for face and nose reconstruction that are made with cartilage and very advanced compared to what we had 5 or 10 years ago.
And does that allow you more flexibility to maybe work faster, to have more, I don't know, what things you can do?
I think it's faster operations. They're safer for the patient. We can do smaller incisions because of these innovations. It's really emotional, especially for the parents. There's a moment where you bring their child back and the child's still asleep, and the parents see their child's face for the first time with the reconstruction, and that is always emotional for myself, the family, anyone in the room.
Well, as a parent and a grandparent, I'm wondering if I ever had a child in need, do you have to educate me, let me know what the procedure is going to involve?
I think that's one of the most important things that I do, because most of these children are so young that the parents or grandparents even are making decisions for them. And it's very difficult because you're deciding for somebody else how they may look, or a decision that was all yours. So it's very important they understand what the procedure involves, the recovery period, and what the risks are.
For some procedures, does it take more than one operation?
It does. Something like a cleft lip and palate, those are staged over the lifetime of the patient. I often joke with the patients and their family that I will grow old with them, because I'll meet them when they're just born, and there's a series of 5 to 6 operations I do until they turn 18. So wow. I'll know them for their whole life.
Oh, wow. Tell us again, what are some of the most common procedures that you'll do here? You talked about the cleft lip. What other procedures?
Right, there's cleft lip and palate. There are, I'd say most commonly, injuries, as we mentioned, dog bites, accidents, things that leave scars that are painful, unsightly, or something the parents want to not have anymore. Those are common. Moles, lumps and bumps, they're little masses that kids can have on their face or their bodies, and we want to make sure there's not a cancer or something dangerous. Those are very common procedures I do here. And then burns, as we mentioned, they are more common here than most other parts of the world, so we're very experienced taking care of those.
I believe I saw pictures, even tongue procedures. Some children are born with tongues that need repair.
That's right. It's called tongue tie commonly. So the tongues are tied down to the bottom of the mouth, so the children have problems breastfeeding or feeding from a bottle. They may have trouble sticking their tongue out of their mouth, which affects speech. So that is a 10-minute procedure that I do here very commonly.
It's just such an experience to be able to go into the operating room with Dr. Yao and to see the child after the procedure. Thank you very much, Dr. Yao, for letting us join you.
Thanks for having me.